Something which very much surprised me, but now on reflection I understand, is that cancer-associated thrombosis patients will often find the experience of the clot to be more distressing than the initial cancer experience.
That's interesting, actually.
And it doesn't seem to compute, but if you look at it this way, when you have the news broken to you that you have cancer, it tends to be done by someone who is trained how to communicate.
Mm-hmm.
It is done in an agreeable environment, the time is taken, offers of support, offers of counselling, availability are there. That's what happens when you're given a life-threatening diagnosis.
Mm-hmm.
But a thrombus is a life-threatening diagnosis as well, but I don't believe people get given the information in the same sensitive way.
So it's just given and then here's some
You're breaking bad news, you got a clot, here you go, here's some injections, go off, be free. The other side of it is that often the symptoms associated with the thrombus, patients may find are more distressing than the symptoms they had when the cancer was diagnosed. Often now, not always, but often we will diagnose cancer through screening programs.
Yeah.
It'll be found incidentally as a lump which isn't causing any distressing symptoms but needs looking at. Whilst the patient who's had sudden onset chest pain and been unable to breathe, that is a traumatic experience. Furthermore, because this has happened early on in their cancer journey, it is a watershed moment of this is serious.
Of course.
And I've just had another threat to my life.
And now what?
And now what? What does the future hold? We've done some research which suggests that patients who have had a clot, not cancer patients, but general patients who've had a clot, may go on and develop symptoms suggestive of post-traumatic stress.
Yeah.
And that makes sense really, because to get PTSD, as they call it, you need to have a sudden, unexpected threat to life, live with the uncertainty of whether that clot or that threat may come back. These people often describe symptoms of panic, symptoms of anxiety, hypervigilance, hyper-awareness of symptoms, any breathlessness, any pain in the leg, you're worried again. So it has a profound psychological impact.
Absolutely.
And if that is all part and parcel of this cancer journey, it can cause a lot of distress.
A lot of the people that I know that have blood clots, they suffer from PTSD.
Absolutely.
And their family members are stressing about it as well, so everybody's affected in it.
And that's an important point that you've made there. Cancer-associated thrombosis is not a single person experience.
Yeah.
It affects all the people around them. When your loved one is ill, your loved one has had a threat to life, you are the one who's seen your loved one breathless and distressed. That is traumatic. But the positive side of it is also the family, and we found this particularly in our Spanish study. The family will take an active role in support and managing that cancer-associated thrombosis. Often it will be the partners who administer the injections. They will be the advocate for the patient. They'll be the ones saying, you need to get this checked out. No, it's fine, it's just the chemo. No, go and see someone.
We need more of that.
We need more of that,
Absolutely.
absolutely.
Can you apprise us on what their concerns are?
Sure. What we were looking at specifically was what did they value most about their anticoagulant, so their blood thinning medicine to treat cancer-associated thrombosis.
Yeah.
Because whilst the evidence is strongest in the injections, there are tablets available, and maybe someone would prefer a tablet even if it didn't work as well.
Of course.
So we asked patients to rate what features were most important to them. And they said, number one, they wanted a medicine that didn't interfere with their cancer treatment. Number two, they wanted a medicine that was effective at preventing blood clots. Number three, they wanted a medicine that was safe and had a low risk of bleeding. And only if those three things were met would they then say they would opt for a tablet over an injection.
Okay.
So patients very clearly said to us that they value safety and efficacy over convenience.
Perfect, thank you.